Good evening, everybody. Very warm welcome from me, John Patricius, on behalf of WiSH, Vid Sport and Health, to another of our webinars. And we're very delighted to continue our theme on the foot and ankle. We've had a couple of great talks on the ankle, the running shoes one most recently. And then those of you that have been listening to our podcasts would have heard the 4 podcasts that we've had on foot and ankle injuries as well, by Dr. Paulo Ferrao and by Lindsay McAvoy as well. So for those of you that haven't, go to the WiSH website and you can catch up on those webinars which are up there, and also on those podcasts which are well worth a listen as well. So a warm welcome this evening, and also to my co-host this evening, Dr. Paulo Ferrao, who joins us. Well-known orthopedic surgeon with a special interest in the foot and ankle, based at the Netcare Linksfield Hospital. Paulo here to help us field the questions and direct some of the discussion after this presentation. Also, as always, a big thank you to our sponsor for this evening and for the webinar series, Acino Lita, the pharmaceutical group, manufacturers of Zifo and DS24, the sports supplement. So they've been great supporters of us, and we're very grateful for them. And then don't forget to fill in your details at the end. Click the link to make sure you get your CPD points. Please enter your correct details, as those are the details that will appear on your CPD certificate. We seem to have got the system working quite efficiently now, so thank you to Nadine Peterson, our who manages the process from the WiSH office. You should receive your certificate within the next 10 days or so. And please interact with us. The speaker will probably ask you a few questions, but ask your own questions on the question and answer facility rather than on the chat facility. Use the Q&A facility, and we'll make sure that we put those questions together and get as many of them answered afterwards by the speaker as possible. So welcome, let's move on with the discussion. I'm going to hand over to Dr. Paulo Ferrao, who's going to introduce the speaker for this evening. Thanks, Paulo.
Thanks, John. Evening, everybody, and welcome once again to the WiSH Wednesday night webinars. As John mentioned, we'll be continuing with the topic of foot and ankle. And as he mentioned, please, guys, do ask questions. You know, the more questions you guys ask, the more interactive it is, and the more we gain from these kind of webinars. As mentioned, the speaker will be asking a couple of questions during her talk. So please use the Q&A box, not the chat. It's a lot easier for us to keep track of the answers and the questions if we just use one of the platforms. So going forward, I have the honor of introducing our speaker this evening, and this is Janine Paladin. She's actually a former professional ballet dancer with the State Theatre Ballet Company, and is currently a biokineticist and Pilates instructor with 17 years of experience. Now, by combining her experience as a professional ballet dancer and her knowledge as a biokineticist, she's now become one of the leaders in the rehabilitation of dance and gymnastic injuries. And thus, I would like to hand over to Janine for her talk this evening. Thanks, Janine.
Good evening, everyone. Thank you, Paulo, for the introduction. I really appreciate being invited to talk this evening, and I hope to share some of my knowledge with all of you moving forward. I think we can get started, and moving on to the presentation, I can, Robin, do I share my screen myself, or are you going to do it for me?
You can share your screen.
Great. Okay, so I'm just going to move on to our presentation tonight. And we're going to be, basically what I'm going to be discussing are the injury management of dancers and gymnasts. As previously mentioned by Paulo, I was a professional dancer with the State Theatre Ballet Company. If you have a look at the screen at the moment, the picture there is of me. I'm the second dancer in the back. I'll just mouse over at that, so me. Couple of years ago, feels like a lifetime ago, but I'm basically drawing from my experiences of being a dancer, everything that I went through, as well as all my experiences in the company with regards to injury management, what I saw, what happened with the other dancers in the companies, and what everyone went through. as we go into this, there are so many different aspects of dance and dance injuries to consider, even when we're talking through the entire body or even just with the foot and ankle. The reason for this is that dance and gymnastics and ballet are extremely complex sports. And for this reason, the main thing or main components that I'm going to be sort of discussing is your technique of ballet. And the reason for this is ballet is your foundation of any form of dance. If you understand the technique of ballet, you can pretty much do any form of dance. Is a branch off from that, and it's the foundation of moving through any form of dance, gymnastics, rhythmic gymnastics. And if you have a good understanding of the technique of that, you will be able to be a good practitioner with rehabilitation of these types of injuries. So for this webinar, I would like to just keep it to 4 main key concepts. And first off, the first concept is I'm going to do a basic introduction of what dance and ballet actually is. And this might sound rudimentary, but an understanding of this is really important. Secondly, I would like to touch on the anatomy and biomechanics of dance, where we then bring in the type of technique which is required to be able to perform these certain movements. And third is I'm going to touch on certain common ballet injuries or dance injuries. These are extremely similar to that of gymnastics injuries. Like I said, I will mainly be referring to ballet injuries, but it does translate over to all these different disciplines. And then fourthly, how to assess a dancer with an injury and how we assess it differently than assessing your average person who comes to you for lower back pain or ankle or injury or knee injuries or lower body injuries. And also I'm going to touch briefly on the differences between young dancers' injuries compared to that of professional dancers. So as we go through to it, we're going to go look at the introduction of dance or ballet. Now, if we have a look at ballet and dancing, we need to ask the question, what is it? Now that might sound a bit of a strange question, but it's extremely important, because if we look at dance, we need to ask ourselves, number one, is it an art form? Which, if we have a look at the picture of this principal dancer doing Swan Lake, it's very artistic. You can see the expression through her face, the body, the movement, everything. She's telling a story. But if we have a look at the second picture that we show, it's a very powerful, explosive motion, movement. And if I have to look at the second picture, I would say more, she's an athlete. She's a sport, an athlete. The differences between the two are quite significant, yet it is the same art form. So depending on what type of dance they're doing, a lot is expected from these different dancers. And I would have to say, sorry, I'm jumping ahead, that like I say, dance or ballet is a combination of both. And if we look at something like rhythmic gymnastics as well, it's an extremely a powerful type of sport. They're expected to do many different acrobatic movements, yet they're also supposed to look very ethereal, controlled. Everything's made to look easy. And I would say the combination of the two is extremely difficult, because you are expected to do these extremely complex movements, yet still be an artist on stage, an actor, and tell a story and captivate your audience. Whereas if you're a soccer player, a runner, or if we compare it to any type of, you can say, normal sport, you just out there and you do your thing. It doesn't matter what your face looks like. It doesn't matter what your arms look like. Everyone has different running styles, different movement styles. But when you're in this type of movement or dance form, everything is important and everything plays a role. And this is important if we start looking at the evolution of dance. On the left-hand side, we see a picture of Dame Margot Fonteyn. She was one of the most prominent prima ballerinas of her time. And this picture of her is in Swan Lake, obviously one of the most well-known ballet productions. And this picture was taken in around 1940, where she was a principal dancer. Now, she entered the ballet world at the age of 16, and her lifespan or her career lasted many, many years, and she retired at the age of 60. Now, in today's day and age, that's not heard of. We can have a look at how the dancer's shape is different to the others. Her style is different. The shape of the legs are different. If we look at the middle picture, this is one of the prima ballerinas of the Bolshoi Ballet, which was taken approximately 2 years, again in the production of Swan Lake. And we can already see the evolution and how things are changing and what is expected of the dancers. The angles become more sort of squished and expected more of them, the height of the legs, the height of the arms. If you have a look at the position of her back in comparison to her leg, it's more of a 90-degree angle than that of the first picture. And around this period of the evolution of dance is that dancers usually enter the professional world on average, I would say, between the ages of 18 and 19. And the career isn't actually that long. It lasts for about 10 to 15 years. They usually all retire around the age of 35, max pushing it to the age of 40. So those are your hanger-oners, the ones that really want to push through the career as much as they can, and also those who aren't plagued by injury. And if we have a look at the third picture on the right-hand side, this was taken in early 2020. This is a young dancer in a studio. And you can see the difference in the position of the leg in comparison to the previous two. The type of movement she's doing is exactly the same as the other two. It's called an arabesque. But you can see it looks far more ballistic or gymnastics types of movements, the compression into the lumbar spine, everything is just over the top. And why I'm showing you this is so that we can see what is expected of the dancers as time has moved on from the 1940s to 2020. Yet not much has changed in regards to the training of these dancers, the injury prevention or the rehabilitation thereof. So if we come and have a look at the anatomy and the biomechanics of dancers compared to other athletes. Now, if we have a look at anatomy, obviously, how does it differ? Well, anatomy is anatomy. That's not going to change. Although everyone's anatomy is slightly different, obviously the curvatures of the spine are slightly different, the positioning of the pelvis is slightly different. We have different shapes or attachments of the hip into the socket. Some people have more hyperextended legs, the acute angle of the knee is different, the position of the ankle is slightly different. But at the end of the day, your anatomy is anatomy, but we do need to take into consideration the variations that of this anatomy and the angles of attachment as you're going to be looking at dancers with the injuries. If we then move to the biomechanics of the movements. Now, biomechanics of the movements, I'm basically talking about the technique of a dancer or a ballet dancer or the form of dance or ballet is very different to that of any other sport. So if we have a look at your type of sports, which include running, swimming, soccer, they all produce a singular type of movement where you're moving in one direction, a unilateral movement, where you're continually moving forward or back or sideways, and maybe you have some change in direction, but your general type of movement is unilateral. Majority of forms of sport have some type of running in. And biomechanics of dancing is very, very different. A dancer is expected to move in very different directions on a beat very quickly. So the stability of the dance needs to be extremely good. And if you don't understand how that technique is applied, it's very difficult to understand the mechanism of any injury that they may have coming to see you for. And again, I reiterate, if you understand the technique of ballet, it becomes far easier to rehabilitate that injury. You wouldn't really try and understand or rehabilitate someone who comes to you with a running injury if you don't understand the biomechanics of that injury. So you need to learn the biomechanics of and the technique of dance, of ballet, to be able to actively or effectively put them through a rehabilitation program. Another thing to consider is that dancers, when you're assessing them and with regards to their biomechanics, is that they generally tend to have a greater flexibility. Now, some dancers are not born with natural flexibility. They've had to work extremely hard for it. Other dancers aren't born with, or say born, but they're naturally more flexible. So you can't apply your standard norms of measuring flexibility when you're working with a dancer. Obviously, you cannot apply to your norms of tables, of this is where you should be, or when you have doing a straight leg raise, your legs need to be at 90 degrees. A dancer, that's just going to be a joke for them. And you're not actually going to be getting anything out of that. You're not going to be getting any feedback with that, is to see if they're getting any pain or activation. The increase in flexibility can be a good thing, but it can also be a bad thing for a dancer. A good thing is that obviously it increases the potential and ease of movements while they're doing these complex movements. And the bad thing is that it actually can create incorrect technique patterns for them to try and gain the range of motion that they're doing to try and produce a certain movement. So we need to consider those different things and as you're moving forward with your assessment. So the other thing that is obviously extremely important is with regards to the flexibility, and especially those who are hypermobile, is that they need to have a balance between their flexibility and their strength. If you have a dancer who is extremely flexible, and I find this a lot with younger dancers who haven't quite got to the stage where they are strong enough, but they have the natural flexibility, what we call natural flexibility in dance and gymnastics, is that they tend to throw their legs or throw into positions where they do not have control. And when they do this, they're at extreme risk for injuring themselves. This generally leads to injuries like labral tears or a pinched nerve into the lower back. So hyperextension and throwing into these deep positions without having the strength or stability around those joints will obviously increase their risk to injury. So we need to take into consideration those types of things as well. Now, if we have a look at ballet technique, now this is where I would like to bring in a little bit of interaction from you guys, is that I personally feel over the years that ballet technique has been completely misunderstood. This is why I talk about the myths versus the reality of what it actually is. And I've heard many practitioners telling moms that their daughters shouldn't be doing gymnastics or ballet because it's bad for your back. The only reason that I can come up with that they are telling their dancers or their daughters or the parents this is that they do not understand the technique involved. So what I would like to do is ask you guys what type of technique you think is really important with dancing. But before I get to that, I'd also like to just mention that when we have ballet or dancers, now when we're working with dancers, the majority of us as practitioners are probably going to be seeing our young dancers, which probably range between the ages of 14 to 19 before they become professional and they move up into the company. So that's the type of dancer that we're generally going to be working with. And the first line of defense for those dancers are actually the teachers. Now, there is a big problem with the teachers that we have in South Africa, and I'm not bashing our ballet teachers. We have some amazing teachers out there, but I do feel that there is something lacking. So when we're looking at our teachers teaching our young girls the ballet technique at a young age, because that's their foundation going up to become a professional dancer, a lot of the teachers don't actually understand the technique properly. And what they do is they implement these skills and their techniques, their tools and imagery that they're using to try and impart onto that knowledge onto their students is what I call old school. And they use that because that's what they've been taught. And they were taught that from their teachers. and it worked for them to a certain degree, and that's what they remember. So that's what they're now going to impart on their young dancers. And then if you go to their teachers, the teachers did the same thing, and so on. So what we're finding happening is that the teaching style, the tools, the imagery, and how to implement the technique is going back about 4 or 5 generations with the same teaching style. But if we look at how ballet has evolved, and on my second slide, you can't teach the same way that we have been doing for the last 5 generations and expect those results and expect the dancers to be able to perform like that without getting injured. So that needs to change, and that perception needs to change with regards to the technique. Dance medicine has evolved so much, even in the last 20 years, and we really should be bringing this in with our dancers at a young age, bringing it right through the companies. So going back to the myths versus the reality of ballet technique, I'd like to, our guys, pop into the Q&A. And so I'd like to ask you, what do you understand by the proper technique of a dancer or a gymnast? Now, if we're looking at a ballet dancer, the main thing that I'm gonna focus on is the pelvic position. So if we have a look at the pelvic position of a dancer, I'd like you to just pop in your questions, and or should I say your answers, and let's see what comes up, because I'm very interested to hear from practitioners who've been exposed to potentially working with dancers and those who want to work with dancers. Understand the position, or the pelvic position of a dancer when they are moving around or training or whatever. So if we look at the pelvic position, there are 3 types of pelvic positions. And we have obviously your posterior pelvic tilt, your neutral pelvis, or your anterior pelvic tilt. So I'd like you to sort of think and give me which one do you feel is going to be the right position, or the correct position for your dancers to be working with. I'm going to have just a quick read through some of the answers that are coming through. Yeah. All right, so I'm just having a look at some of the answers. We have question mark, neutral pelvis, standing posterior pelvic tilt, anterior pelvic tilt, neutral, anterior, neutral. So some of them are going, so movement control through all different positions. Yes, I agree with that, but when we're looking at a standing static position, let's say in first position, we want to know what position you're actually meant to be standing on. So it seems to be that the answers are very varied. So it gives me an indication of the number of people that are actually attending this webinar. No one really knows which is supposed to be the correct position. Now, if you don't understand which is going to be the correct position your dancer is supposed to be in when you're working with them, how are you going to do the rehabilitation with them correctly? So as we're going through them, I'm just going to close my Q&A there, I think. How do we close it? There we go. So we're looking at the pelvic position. Here we have your anterior tilt, and there we have your posterior tilt. And I'd like to say, yes, one of the participants said that moving through and control through all of these positions is really important, yes. However, your neutral pelvic position is the most important. So when a dancer is standing in first position, a neutral position is the most important. An anterior tilt or posterior pelvic tilt puts a lot of extra strain on certain muscles and areas that shouldn't be there. So if we have a dancer standing in an anterior pelvic tilt, which is obviously this one on the left, We shorten the hip flexors, we increase the pressure, or should I say the shorten up into the lower back. You open up and increase the extension through the hamstrings, which causes extra weakness through the hamstrings. And it actually doesn't enable you to get your leg up into the right position where you want him to. If we have a look at the posterior pelvic tilt, which some of you said, and I find that this is the most common answer with practitioners, teachers, and this is the information that is being put out there, that the dancer should be standing in a posterior pelvic tilt. Now, the big problem with the posterior pelvic tilt is as you do that, as you rotate the pelvis posteriorly, you actually lock the hip joint down, and it limits the amount of movement that the dancer needs to be able to do to move the leg around. So when you are doing ballet, you need to do a lot of movements, what we call rond de jambe, which are circular movements of the leg. This can be on the ground, slightly elevated, or extremely high. And if you are in a posterior pelvic tilt, you literally lock those the hip joint down, which doesn't enable you to actually release and open up those hips to get the leg up. Another thing with that is, as you're pushing down into a posterior tilt, you actually overload the quadriceps muscles, which makes your muscles quite big and bulky. And you can actually see very quickly if a young dancer walks in to come and see you and their quadriceps are extremely bulky. And that means that they've been working into a forced posterior pelvic tilt when they're actually also squeezing the glutes under. And you will hear a lot of the dance teachers say, tuck, squeeze your bum, tuck your pelvis. It's not very, very effective. So the neutral pelvis is extremely important. And if the dancers are able to maintain the neutral pelvis, they are then able to have more control through the other pelvic positions while they are moving. So if we have a look here, this is obviously what we call the anterior pelvic tilt. Obviously, it's extremely exaggerated, but some dancers actually do this. And if you have a look on the right-hand side, we'll have a neutral pelvic position. We have an extension through the spine and opening up the front of the hips and the flattening of the front of the thigh. Now, this is obviously, your neutral position is very different from one person to the next. The easiest to see the neutral position from a practitioner's point of view is not to look at the curvature of the lower back, because each person has a different curvature in the lower back. The lumbar curve, some people is more exaggerated than others. The best way to actually see this is to have a look at the position of your ASIS and the pubic bone. And what the dancer needs to do is actively lift up through the front of the pelvis, pulling it up into a neutral position. You can see clearly on the right-hand picture that the ASIS and the pubic bone are on the same perpendicular plane down the front of the leg, opening up the hip. So this is very, very important to understand how to get into this position and how the dancers are actually maintaining this position. So how they're maintaining this position is obviously going to give you an indication of which muscles are working and which muscles are not working. So how to teach this neutral, correct pelvic position, it can be extremely challenging, but I generally find if I tell my dancers to lift up from the pubic bone, lifting up, not tucking from underneath, not tucking from the posterior with the bum, but lifting up and opening up the front of the hips. With that, you're getting a lifting and a rotation through the legs and not squeezing the bum under to work into your turnout. We then move on to, so that's your basic biomechanics of that. If you understand that, that then translates into your different movements. With your common ballet and dance injuries, there are so many that dancers can be subject to. So I'm going to focus, I'm just going to run through very few that are sort of the most common, and obviously are your hip injuries. These are a list of sort of the most common hip injuries that dancers and gymnasts usually are subjected to. And many of these, if you have a look at them, are actually due to incorrect technique. So if we have the correct technique of opening up the front of the hip and lengthening through certain muscles and rotating, you won't get hip impingements. Now, hip impingements and labral tears generally occur when the pelvis is tucked too much. So you get a forced pelvic position. And then as they're doing the rond de jambe, which is your circular movements of your legs, you start getting the compression and the impingement and the friction of the hip. And then that's when your labral tears and your hip impingements start happening. If we enable them to lift up through into more of a neutral pelvic floor, that impingement slowly disappears and it creates space for the legs to move. Same with your sacroiliac joint dysfunction. Hamstring tears, again, a majority of them come from incorrect pelvic position. So your hamstring tears is if you are standing in, let's say, an anterior pelvic tilt, you have an extension through those hamstrings. Generally, they're not functioning properly in co-contraction with the front part of the leg or the hip. And we generally overextend into them, or they're not developing enough strength so that when you move in, they're vulnerable to hamstring tears. The second sort of most prominent area are your ankle and foot. And these are your tendinitises, your trigger toes, ankle impingements, ankle sprains are very common, as well as what we call a dancer's fracture. But again, a lot of these can be fixed with corrective technique and understanding thereof. The third group are our stress fractures. And this is very common in dancers, especially in the lower limb. We're looking at the metatarsals, tibia stress fractures from extreme jump forces. Lumbar spine can also happen with extreme large jumps, which we call grand allegro, and kicking the legs up. But these are usually due to repetitive injuries, extreme practicing, pushing your body harder, and all those types of things. So when we're looking at our common injuries, the dancers are subject to extreme forces on the body, and later on in life, many dancers do generally develop form of arthritis, usually in the hips, ankles, and feet. Knees. Knee injuries can be prevalent in certain dance groups, although ACL injuries tend to be less than that of, if we talk your common sports. Now, that has been put down to two sort of major components. As dancers progress and from a young age, they're sort of subject to quite heavy loads of jumping from a young age, and then the corrective technique thereof of landing and absorbing the force through the legs. Also the corrective technique of stabilizing the pelvic girdle as well as those hips. So over the time, they should have enough strength that in turn stabilizes the knee. And then, I just thought this was a very, very apt. A lot of people say, oh, well, ballet is beautiful and it's amazing. And are they slippers? And they, it's extremely hard on your feet. And dancers just push through it, and that's just the way it is. So when we go back to assessing someone with a dance injury, when someone walks into your office, just be very mindful of what you tell them with regards to taking time off from dance. Now, dancers don't generally share injuries that they have for fear of many different things. One of them is non-promotion, removing from a production that you could be working in, a certain opportunity that you may have. And I often feel that practitioners will say to dancers, oh, well, you need to take 2 weeks off. And it's not always possible. So there are ways that we can work around it and help those dancers through those periods. while they continue to dance, but rehabilitate them. And obviously they won't be dancing to their full capacity, but it is possible to continue the rehabilitation while they are still dancing. Obviously, depending on the type of injury. If we have a stress fracture, then it's a no-go. Broken bones, obviously they need time off, and then slowly rehabilitating them back to their former glory. Also, again, with the psychological impact of telling a dancer that they need to take time off, as a medical professional, it is really important that you understand the corrective technique so that the time off is limited, so that they're not receiving a misdiagnosis. Misdiagnosis for a dancer is one of the worst things that you could possibly impose on them. And to try and get them back to their sport is extremely important. When we have a look at assessing ballet and dance injuries, we need to assess them very differently to the way that we would assess a runner or a general, your average person that's coming in to see you. And there are many different aspects that you need to look at. So what I would like to say is, the longer that the dancer is off, obviously there's greater risk of them losing certain roles or being promoted or whatever, and the psychological impact is huge. And the picture that I've put on screen right now is a picture of me when I was in the Nutcracker at the State Theatre Ballet Company. I'm here on the front on the left-hand side. It feels like a lifetime ago. I was a baby. But nonetheless, this was my first year with the company. And as we neared to the end of the year, we always did the Nutcracker. It's a very prominent and exciting ballet, and the audiences seem to love it, especially that time of year over Christmas. And the picture of me is in what we call the snowflakes. If any of you know what the Nutcracker is all about, it's about this little girl who receives a little doll, and she's then transformed into this magical land where she goes off to the land of the sweets. And as this transformation goes into the magical land, the snow starts falling and we are the snowflakes. So as this production carries on, there's a certain part in the snowflakes where you jump directly onto point, diving quite far forward with each step directly onto points into a circle. So propelling yourself round into a circle, and you go around 3 or 4 times, and before you continue in with the dance. And now obviously this direct jump straight onto point is quite an increase and an impactful force through the lower leg and the feet. Now, as this was my first year in the company, I was there to impress. I wanted to do well. It was the end of the year. I was thinking of potentially getting a promotion or moving up the ranks, and I really wanted to show my worth in the company. The Nutcracker run is one of the longest runs that they have in the year. When I mean by the run, it is the length of time that the production runs for. So towards the end of the year, the Nutcracker runs for about 3, sometimes 4 weeks. And if we're looking at the number of performances per week, we would usually do, moving towards the first week, not so many, but second, third, and fourth week, we would usually do an evening performance on the Thursday, a Friday matinee and evening performance, Saturday matinee evening performance, Sunday sometimes we would do a matinee as well, depending on demand. With those performances, you would also have an hour-and-a-half class before your matinee, before moving in. Now, obviously, with this increased load and the high impact of diving directly onto my points, I started getting quite a lot of pain across the top of my right foot. Now, being a young dancer, I didn't really want to say anything. It actually felt a bit like a sprain, rubbing it and making it feel a little better and massage it, and we go onto stage and we do it again. Obviously, each performance, it started getting a little bit worse. Now, this is what dancers' mentality is like, is that we'll go, oh, my foot's feeling a bit sore. You don't say anything to anyone and take a painkiller, dance on it. Feels okay because you cannot feel the pain, and the next performance you do the same, and the painkillers slowly get a little bit more, or a painkiller and an Emla cream, which is a local anesthetic cream, which we used to rub on our feet as well. So by the end of the season, after the last performance, I couldn't really walk on my foot, and that's when I was referred for a sonar. It turned out I had a stress fracture across the top of my foot, or across the arch of my foot, which I'd been dancing on for 3.5 weeks. Now, that just shows the mentality of a dancer, and that needs to be taken into consideration as to where this person is in their career. If it's 2 weeks to go, you can't pull the dancer. Obviously, if it's extremely bad and they're unable to walk, you need to weigh up the two. And I'm not saying it's good to let a dancer dance on the stress fracture, but it needs to take into consideration how many performances they have left, what their pain levels, what it's like, how deep or how bad are the injuries, and how can you assist them to work around these injuries to get them forward in their career. So when we're having a look at the assessing, we need to look at the patient holistically. Like I say, taking the mental capacity, physically, everything. We'd start off with your assessment with your basic patient history, like we do with any other assessment. We take down the mechanism or the type of injury, where it's sore, how did it happen, how long have you had the pain for, what type of pain you have, etc. We then move on to your posture. Now, I like to do 2 types of posture. One is your anatomical posture, which is your normal posture analysis, which is obviously person stand in front of you, shoulder height, what's happening with the spine, height of the ASIS, knees, what's happening, is there any valgus or varus happening in the knees, what is the Q angle, we do your side analysis and everything, and then we move on to something what I call ballet posture. Now the ballet posture is really important. Like I said, it gives you an understanding of which muscles they are activating to get your ballet posture, and this moves back to the pelvic position that we were talking about in your neutral pelvis in your first position. So when we're having a look at your ballet injuries, this is what I would ask the dancer to do. So standing what we call first position. And I just want to pop into the Q&A again and just briefly write for me 1 or 2 key factors that you may or may not see in this position or in this picture. So we can just have a few people just jot down what you see or what you don't see. If you don't see anything, that's fine, and you're here to learn. If you do see, let me know. Anyone? Left knee pain, pronation of the foot, correct. Right, rolling of your feet, correct. Okay, so we have your drop foot, or your rolling of the foot, which is what we call in ballet, your foot is rolling. Pronation of the foot is a little bit more of a technical term. Okay, so we can see the position of something that is not working well. If we have a look at the second picture, we can see a much better position of the foot and lower leg. Now, how does one fix that? Now, if you're looking at your pelvic position and you're pulling the pelvis up into your neutral spine, you will see the opening of the front of the hip, the pulling up of the quadriceps and wrapping. That wrapping feeling through the glutes will actually lift the knee into its correct position and naturally lift the arch of the foot. Now, what a lot of people try and do is they try and correct the position from the foot. It's actually got nothing to do with the foot. It's got to do with the lack of control through the pelvic stability. And that's where one needs to actually focus on. If they're able to stabilize through the pelvis and activate the rotation into your turnout correctly, this is then what will fix the position down at the foot. We have a look at another one. This is pressing up onto a rise. And again, you can see the pronation of the foot, the dropping of the arches, the feet pushing forward. And in your picture D, we can see a much better correction. So what's happening is, as the dancer is pressing up onto demi point, they're just letting everything go, and you'll probably find this slight internal rotation of the hip, which causes the knees to roll in slightly and then the ankle to drop down and forward. When you're standing on demi point, your balance or your weight should be between your big and your second toe, your big toe and your second toe. In your second position, second picture, picture D, you can actually see, well, you can't really see too high up, but I can see just due to experience that the inner thigh activation is actually working as well. And picture C, your inner thigh activation is not. If we're having, so continuing with your assessments, you're going to also again look at, so we had a look at 2 different types of postures. Your functional movement, you're also going to have a look at 2 different types of functional movements. Is your general functional movement, which is like your squats, single leg squats, seeing what's happening with the legs, the stability of the pelvis, the knee, balancing on one leg, maybe walking, gait, that type of thing. And then what I call ballet or functional movements. Now, again, it's very important that you understand the different types of words and techniques and positions. We've got a little girl doing what we call a plie there, obviously not too great, but she is only 3 and very cute. But we're going to ask the dancers to do a functional movement, biomechanical functional movement. So again, we can see what's actually happening with the technique and what muscles are activating and which ones aren't, to assess how they're working. So this is what we call a grand plie. Just quickly, can anyone tell me what they see in this position? So let's just see if any answers are coming through. Okay, so one answer I see here, right, left foot rolling forward, limited extension through hip rotation, insufficient external rotation of the hips, collapsing of the foot. All right, so having a look at all these answers, a lot of you are focusing, and this again I find is a downfall of people looking for what is corrective technique and not, is you're actually looking at the result of the incorrect technique when you're looking at the foot and the hip and the internal rotation of the leg and the foot collapsing and rolling forward. If we have a look at the actual position of the pelvis is in a posterior pelvic tilt. So as you're doing to your posterior pelvic tilt, of course the hips are going to lock down. She's not going to be able to open up the hips into your external rotation, and that in turn is going to then pull the foot into the corrective position. If we have a look at the position of her foot, she's way over the big toe rolling forward. If we correct into more neutral spine, you can see she has a neutral curvature into her lower back and her bum sticking out slightly. She's now able to externally rotate and activate through her rotators and her glutes to open up the knees, which then in turn brings the foot back into your neutral position between your big and your middle toe. You can then also feel the extension through the upper back, and she's able to activate and engage properly into her core in the front. This is another one where we're having a look at the landing, singular leg landing of the leg. Similar thing, we can see the leg is rolling and her thigh is internally rotating, rolling forward of the ankle. And again, if we have a look at the neutral, lifting up through the front of the pelvis, you'll be able to externally rotate that leg, bringing the weight back into your neutral position of the foot and lifting up through the ankle. So we would then move on to your palpation and flexibility. Now this is a big one. I would do 2 types of flexibility with dancers, your active flexibility and your passive flexibility. Now passive flexibility is the practitioner's chance to feel for any end feels, squishy end feels, locking end feels, hard end feels, gives you a good indication of what their range is available. But one of the most important is actually the active flexibility. So asking a dancer to actively lift the leg as high as they can. Now dancers generally are competitive in nature, and they will like to try and show off with their flexibility as to how they can go. And I'm talking more your younger dancers, not your professional dancers. The professional dancers have a little bit more understanding. But your younger dancers are like, ooh, look how high I can get my leg. And by doing that and them showing you, that's generally how they would do it in a performance or an exam, because they're trying to perform at their best. And it gives you a great indication of which muscles they're actually using incorrectly, which could potentially show you why they are getting an injury or whichever injury they are getting. And then we would go through your normal special tests as practitioners that we've learned. And then what I call performance of special movements. Now, this is asking the dancer to try and mimic or recreate the movement that they did, which created pain. Now, if the movement that they did created pain was an extreme high leg movement, you're obviously not going to ask them to go into that full range. You're going to ask them to do the movement at a slightly lower range, just to try and see again the activation and the coordination and the technique that they are implementing at that level, to see what is involved. And then other potential aspects obviously you need to consider is their diet, their mental stateness, stress, fatigue, all those extra things which I'm not going to be touching on in this presentation. We have our young dancers compared to our professional dancers, just bringing this in briefly. And the difference between your young dancers and your professional dancers, and the types of injuries that we see, our young dancers, generally we find the reason that they get injured is due to poor technique. And this again comes down to the understanding of the technique and the teaching thereof by the teachers, which takes it back to the generations. Well, this is how my teacher taught me, so that's what they're imparting. So it can come down to poor technique. Also, the number of girls in the class, that there's not enough individual attention, growth issues, that they may have huge growth spurts, and that's the dancers learning to work with their own bodies, may result in ostrich slatters, the girls who are really tall, so that type of thing. And then obviously that affects knees, tendinopathies, back, scoliosis, age, and hip external rotation. And these things usually sort themselves out as the dancers progress and they become stronger and more aware of their technique. If we look in comparison to professional dancers, they usually have repetitive or overuse injuries. Patellofemoral pain is another one, extreme jumping, stress fractures, as I mentioned, are quite prominent or prevalent in dancers, and tendinopathy or mechanical lower back pain. Those are the general types of injuries that you get. So I just want to touch briefly on how dancers are treated differently and viewed in South Africa versus the rest of the world. Now, dancers in South Africa, unfortunately, are not looked at as athletes. So there is no financial funding for them. Access to equipment can be really bad. Dance studios, flooring, non-sprung floors. Another thing is obviously finance, that dancers aren't paid very well. And like I mentioned, they're viewed as artists and not athletes. And if we have a look at like our top athletes in the country, if we're looking at our rugby players, our runners, they generally have sponsors which enable them to advance their sport. But it's not so prevalent in and among dancers. And the low salaries, they don't really help with medical conditions, and a lot of, depending on which company they're on and how much funding is available, the dancers are expected to pay for the treatments for themselves to get better, which is another reason why dancers don't actively seek help or when they have an injury. And then the screening for dancers when joining companies in South Africa is pretty non-existent. It should be extremely prevalent and important. And by doing this, we could help decrease the number of injuries of dancers moving in through their career. And as I said, medical practitioners aren't as readily available to dancers like in other sports. When you have a look at our sports teams, they all have physiotherapists, they'll have a sports physician on the team and readily available to work with them. And where I'm going with all of this is obviously prevention is better than cure or rehabilitation. We don't want dancers to be injured, and getting them to understand the technique and implementing it correctly and building the strength and work through that is going to be far more beneficial than trying to rehabilitate them. So just briefly or quickly, the Royal Ballet Company in the UK is actually getting it right. Another one is a New York City Ballet Company, and another one is the Australian Ballet Company. And they've actually implemented something, Royal Ballet Companies have implemented something called the Health Suite, which is really quite fantastic. This is mainly for the professional dancers in the company. And there is also the Royal Ballet School has a healthy dancer program. Now, I don't know how much time we have. Okay.
Movement patterns for the dancer to come back from injury. In the healthcare suite, my role involves working with dancers recovering from injury. So there's really two mechanisms of injuries for the dancers here. First is acute or accidental, and the second is really through fatigue or overuse. When you're asking the dancers to challenge their bodies in such an extreme way with lifts and turns, very complex movements, accidents are going to happen.
In the healthcare suite, I mainly use the physio and the gym at the moment. I've currently got a bit of a hip injury. I've found the specific exercises in them have really been supporting that area.
It's important for me because now there's so much choice here. If I'm feeling a bit tight, my body's feeling a bit squashed, I can come and use the gyrotonics machine to lengthen. If I'm feeling like I need a little bit more strength or balance work, I can come and use the Pilates equipment and be instructed in that way. I can also use the gym. If I've got a big partnering role coming up, I can, build myself up that way. If you don't have such a busy day, you can push yourself and work a bit harder. And also you can come in and just do an extra warm-up before a performance. If you've had a break between class and you want to get your body going again, it's great to just come in here.
So stay long for the body this side, scoot and come back.
The healthcare suite is really important for the Royal Ballet because it allows the dancers to have a long, successful and full career. And it also helps us to give them the tools that they can take through later life so that they can also end their career at the Royal Ballet fit and healthy and well.
Rehab is so important. I really learned the difference that it has and the impact it has. The healthcare suite is so important for dancers. It's there as a support for a dancer, really, and we're so lucky to have this on site.
More than 20 dedicated practitioners support and educate our students from the age of 11. We teach them to understand their bodies and minds. Counselors, physiotherapists, performance nutritionists, sports scientists, Pilates instructors, strength and conditioning coaches, and medical team all work hand in hand with the artistic, academic, and pastoral teams to create the best possible care for every individual student. Our healthcare program is innovative and pioneering in using this holistic approach to train dancers. Empowering students to understand their own well-being, we've developed a wellness app to record and monitor their health every day. This data on everything from hydration and training load to sleep and anxiety levels feeds into a database along with regular health screening to build a unique profile for every student. It also creates a body of research which informs our artistic program.
I'm so happy as the director of the company, working very closely with the director of the school, Christopher Powney, in having these wonderfully informed dancers coming across and joining the company and knowing that they are going to have a really strong career because they know from the beginning what it takes to be a professional dancer.
I think for a dancer going through injury, it's always quite a shock to the system. The ballet world, it's obviously very steeped in tradition, and that culture is something that we're trying to preserve, but also the demands of it are always changing, they're always evolving.
One of the most important parts of the healthcare is the psychological side of it. It's nice to know that someone is there for you if you want to speak to them.
Some people have been trained in a certain way, so they're not used to seeing dancers work in a parallel position or train with weights, but that's necessary for what we're putting our bodies through.
I feel like the students are just very lucky at the moment to have this amazing support from the healthcare.
That informed knowledge is what will keep their career going for many years to come.
Okay, so these are the links that we're showing. So you can see that with South Africa compared to the rest of the world, we are quite far behind in how we're treating our dancers and what is actually out there for our dancers to perform and compete worldwide. We're ill-equipped to rehabilitate and prepare our dancers for this lifelong career. So a lot of the times they're still expecting the dancers to just go through their basic training and then straight into a ballet company. And the additional strength and conditioning of the dancers is not actually happening. So we need to start training them at the younger levels. We need to start implementing conditioning, sort of conditioning training with them, corrective conditioning and teaching methods. We need to update their teaching methods and sort of educate the teachers around on how to teach correctly and moving forward. And with this, I want this to be keeping in mind between then and now, how dance has evolved. Where in the 1940s or 1950s, you get nice heights, nice arches, and what is expected today is extreme heights and extreme arches. So yeah, that's everything. And this is a video of a young girl. She is 12 years, she's just turned 12 years old. I've been working with her. She presented with pain into her right foot, approximately end of last year, and she's had pain in her foot since. She's continued to dance with it. This is the 5th session that I've had with her, and she's back, obviously after COVID, back into the studio, and she has no pain after 5 treatment sessions. And this is just working with corrective technique, giving her certain strength exercises, and she's really done extremely well. Obviously, she's got a little bit more to go, but her progression has been amazing. All right, so I did originally do this course as a 2-day course where I discuss a whole lot of factors, including some of the stuff that we've discussed today, and plus additional things, and how to do the rehabilitation and the practical application and the understanding of implementing the technique and the rehabilitation, which is obviously extremely difficult to show over a webinar. Yeah, thank you very much.
Great, thank you very much, Janine. That was a wonderful presentation, and you did a great job of covering such a broad topic in such a short period. And yeah, as you mentioned at the start of your talk, these dancers really are athletes. And actually, recently in the US, dance was ranked as the most physical demanding job in the US. And I agree 100%. I think our dancers are undervalued and definitely underpaid. I mean, as you mentioned, your kind of schedule when you were dancing, it's like 3 shows a day, training before your show, etc. And they really do not get remunerated for the work they do. So yeah, I think a great talk and some really great points. I'm going to start with some questions from the floor, and then if we've got time, I'll also ask a couple of questions. So I'm going to start. There's a question from Mohammed Khan. Now, correct me if I misinterpret your question, Mohammed, but basically what he's saying is lots of therapists take the conservative route and then recommend rest to avoid any future problems. Now, he asks, how do you make such difficult decisions? And I assume where he's coming from, as you mentioned, you know, you had a stress fracture, you might only have a couple of shows left. Do you let that dancer go on? Do you stop them? Now, yes, a metatarsal stress fracture is fine, but now if that was a navicular stress fracture, that could be a career-ending injury if you were to let that dancer continue. Yeah, if you could maybe comment on that.
Again, I think it depends on, like I mentioned in the webinar, in the presentation, it all depends on the type of injury. you can work around it depending, again, it's very injury specific, but a lot of practitioners generally try and say, if you're taking like for example your average normal person who's a weekend warrior and does his trail running and hurts himself and is not conditioned to run regularly and has an injury, 90% of the time, you're probably going to say to him, listen, take some time off, let's rest it, and then start with a little bit of a rehabilitation program, and we're going to slowly progress back to where you were. With the dancer, it's not necessarily the best way to go. Their bodies are conditioned to be able to support it. So if you're able to give them certain pointers to offload the area, and they're still able to continue, let's say, with 1 or 2 more performances, I would say you've got to take that into consideration. It also depends on where they are in a production, where they are in their career. All those things you've got to take into consideration. But obviously, I'm not going to say, let the dancers dance if it's going to be, detrimental to a really bad injury.
Great. The next question is from Natasha Schmidt. She's asking, is there an age restriction to when a dancer can start wearing point shoes? As she's noticed, starting to wear point dancers starting at a younger and younger age wearing these point shoes.
I actually thought this question would come up, and I'm glad it did. There's no actual sort of restriction per se as to when dancers go on to points. However, it isn't recommended that they go on points, I would say, under the age of 11. The bones are still growing, your body's still growing. It's actually not wise for a dancer to go on to points at the age of 11. With that, as they're growing older, obviously they start having more understanding of their technique and how to use their body correctly to get up onto points. And there is a point readiness assessment, which has been implemented slowly, starting to bring it more and more into South Africa, and I'm hoping to present it, doing a presentation obviously to dance teachers as they're the first line, and trying to educate them on all of this with a corrective technique and teaching them how to assess their dancers as to when they're ready to go onto points. And there are certain tests that shows whether they are ready to go onto points or not. Physical tests, just to see if their activation, if their strength is right to go onto point. But I do agree with you, there are many dancers going onto point very, very young, too young in my opinion, and they're just not ready to do so. So probably, in answer to your question, the average age of a dancer going onto point is probably around 12, 13 years old. I would not go lower than 11.
Great. Yeah, the second part of the question was, can you do injury to the growth plates, etc., which you have mentioned? They definitely can get injured, and I think 12, 13 is a good age. Girls stop, the growth plates close around 14, and I agree 100%. I don't see the need of an 8-year-old going on to point. She's got a whole life ahead of her, and you need to build, and everything needs basic building blocks to get to a certain level. So I agree 100%. I think that's a good age to do it.
And another thing with going on to point, when I went on to point, and I actually went on to point quite late. I only went on to point at the age of 15, and I felt that I had quite a lot of work to catch up. But in retrospect, it could have actually benefited me a lot. I had extremely strong feet, which limited the amount of blisters and issues that I had with my feet, besides the stress factor, which was overuse and impact. But the other thing is that, going on to point it's a very demanding thing. And a lot of the young girls really want to go onto it. And even with me going on to points at such a late age, at 15, 16, I still found that my feet even shrunk. So I used to be a size 5, and when I started doing my point work regularly and going up through the years, I went down to a 4 and down to a 3.5. Since I stopped dancing and doing point work, my feet are back up to around about a size 4, but I'm not back to where I was at a size 5. So your feet do sort of shrink, and I think it's got more to do with the obviously slight compression that you have within the foot, and obviously the strength of the muscles pulling, which slightly shorten and compress.
And just along those lines, so actually, it's great that you were a previous professional dancer. What I've seen sometimes in these young patients is that they come to me, and this may be something, as you mentioned, the old school and new school, and they're basically having their feet placed in what to me look like a torture device to get maximum, this wooden block to get this plantar flexion. I mean, is there any benefit to it? Does it really make a difference?
It's called a stretch block. It does look extremely painful. It does work. Depending on the dancer, I may or may not recommend it. It's to try and increase the arch of the foot. Now, this goes back again to your structural anatomy of the dancer to see what angle they have in the ankle, and that's where the extension of the point of the foot actually comes from. It doesn't come from the toes, it comes from the extension through the ankle joint, through the front of the ankle. So they need to be able to open up the front of the ankle and reach the foot over and down to be able to get a nice point. Now, looking at your anatomy and genetics, some people just naturally have a looser foot that they're able to get a nice arch and extending through there. Some dancers have very tight joints, so they need to physically work it to try and increase and stretch the ligaments and tendons to try and create a little bit more of a point. I wouldn't recommend it for everyone, but it depends again on the type of dancer and what structure foot they have.
Yeah, because as you say, I might be wrong, but your elite dancers often have a certain component of laxity or, extra range of motion in their joints. And just like we're not all going to be Usain Bolts, does that block in a dancer who just doesn't have that genetic kind of laxity? Is it going to get it to that level?
You can work it there. It's never going to be the same as someone who has that lovely big arch and that foot that just goes on forever. It's not going to be the same, but at the end of the day, I don't think that's necessarily what you're aiming for. To be honest, those girls with the most amazing feet and these divine arches, they're the worst girls to have on points because they actually push right over the point and they don't have as much stability and strength. So they need to actually work harder to stabilize that ankle joint when they are going up onto points. So in my opinion, slightly tighter ankle is actually better. You've got a little bit more control on your point shoe, and you can work the foot a little bit further. So we find a lot of those girls with extreme arches and very lax ankles, they push right over the block. And when you're standing on your block with your point shoe, you're needing to be sort of right on the tip, maybe slightly forward, and those with really loose ankles and lax feet, they tend to push right over the front of the block, and that brings in a whole lot of different problems, and never mind the damage of your point shoes. Your point shoes don't last long. They'll literally last maybe about a week or two, and then you have to get a new set of point shoes. So strength in the feet is really important on point.
Anonymous, thanks you for a great presentation. And then they say, you mentioned ballet dancers are not recognized as a sport in South Africa, and they would like to know, have you taken any actions to get it recognized, as that can have protective benefits against preventable injuries, financial and psychological implications which occur post-injury? So I think they're basically asking, can we promote it? Can we get them better pay?
So to start off, where I am is this course has taken me approximately 3 years to actually start putting it together. Like I say, this is just a really brief overview, and I've dived really deep into a lot of different things. And my first point of call was to get it out there to medical professionals, because they can start assisting dancers with the rehabilitation process, because we've got a lot of injured dancers out there and medical professionals don't know actually how to deal with it. So that's one point of call. My second point of call is I have a variation of my course which I'm going to be presenting to dance teachers, young dancers, companies, and educators on how to implement the correct technique, proper body conditioning, which they need to be doing, weight training, which we saw in the videos, which dancers don't do. And it wasn't really recommended when I was in the company. You went to class, you did your stretching, you maybe did a little bit of extra things that could improve you personally, and you did your rehearsals. Nowadays, it's because of where dancers evolve to, a lot more is expected of the dancers, and it's extremely important that they actually condition their bodies properly for it, to enhance their career and to have a longer career. So those are my 2 points of call. I'm trying to slowly start getting the understanding and the recognition of dance medicine in this country. I'm part of an international organization which is basically based on dance medicine, and I know that there is one other member in South Africa who is on this part of this association, and it's called the International. I always forget the full name of it, but it's International Dance Medicine Association. It's called IADAMS. People can go and Google it, have a look. They've got amazing information on the rehabilitation of everything. But again, understanding the technique is really, really important to be able to actually take that forward. So South Africa has a long way to go. I do have a lot of contacts in the dance community in the high up. And I'm slowly starting to approach these people, and hopefully we can start changing what's going through with dance. To try and get it recognized more as a sport and getting the funding, well, that's a whole different story. So, yeah.
Perfect. So Petra Zickman, she asks, in your rehabilitation, do you use local stabilizing muscles firing before global stabilizers?
I would say it's difficult because depending on the type of movement that you're doing, you know, the two work together. So I would focus on, if you're talking, I don't really like using the term local and global stabilizers because they can't be used independently. I like to just say you're going to be stabilizing this area. So when you're working with your rehabilitation, it's important to stabilize the pelvis in your neutral spine and then work from there. I'd say that's probably the easiest to do, because when you start thinking of global versus local and what position in which movement, which one should be contracting, which one isn't, you're trying to start isolating different things, and the body doesn't really work like that. And if you're trying to implement and put that across to your dancer, they're going to be like, I don't understand what you're talking about. So if you're able to give them positions and say, I want you to stabilize your pelvis in a neutral spine, and give them landmarks as to where they're looking for and what they're looking for in their position, they'll be able to implement it. You must remember, dancers have a really acute knowledge of what position their body needs to be in, or what position their body is in, and what it should feel like and what it doesn't feel like. And they give you great feedback if you asked for it. So that's where I start the rehabilitation process, is making sure that the stability is coming through from the pelvic girdle, and then moving through from there. Don't focus on local versus global and this and that. But yeah, I suppose if you want to look at it in that regard, I suppose your local core stabilizers, that needs to be active first, and then you can start working into your global stabilizers.
Then we've got a question from Elizna Herman. So can you maybe assist me just in terms of rehabilitation, since lots of dancers are already very busy training, and how much time would you spend on rehab, or would you incorporate the rehab into their training during the day?
So depending again on the type of injury, you would need to do the rehab separately to the dancing. So they would have a dancer, if you're talking more of a professional dancer, or even a young dancer like the one I was working with, she goes to her classes, and I would see her for a rehab session for an hour a day. Well, not an hour a day, I was actually only seeing her once a week, and she already had amazing progress. But what I like to do is I do a rehab session specifically on what they needed to be working with, giving them key points, and then I say to them, I want you to try and implement that into your class. And so they're pretty much doing their rehab while they're doing their basic training. They need to take that and do your corrective biomechanics in their class and their movement and their performances, and that will help alleviate whatever injury that they have. It's going to start building the muscles and the strength and the stability to relieve, let's say, a hip impingement or whatever. whatever potential injury. So yes, working them one-on-one with their rehab and then showing them how to implement that into their daily schedule with their class. So they're not only doing, I think maybe the confusion comes in is that the mindset of practitioners is rehab is like functional movement based. If we go back to the presentation, what is functional movement for a dancer? Functional movement is not necessarily doing squats, lunges, single leg squats, balancing. It's maybe doing a plie. So showing them how to correctively activating their plie, that's going to translate into their rises, their jumps, their everything. So the two go hand in hand. When you're looking at like your normal rehabilitation or your conditioning, that's over and above their dance schedule, which should be. If you look at any athlete, they're going to practice or training, but then they have their conditioning classes and their flexibility classes. It's the same. It should be the same. If they want to be athletes, that's the way that they have to train. You can't just dance.
Then one last question. I think you've been in the hot seat long enough. So just Chris Harps asks, so with the foot structure, so basically saying if you've got a dancer who's got a foot with a long big toe, so it's usually referred to by us as the model's foot. So there's 5 different foot shapes. So the long big toe is the model foot, or a dancer who's got toes which are all in line, which we call the peasant's foot actually. Do they predetermine risk of injury in ballet, especially when you go on point work, etc.?
When you are a younger dancer, I would say not so much when you're working on demi points, because when you're working on demi points, it's not really the toes that you have in your balance on. The toes should actually be completely relaxed. The weight of the body is through the ball of the foot, so through the ball, and then the second metatarsal. That's where your weight is balanced. It's not onto the toes, and the dancers should not be using their toes to balance or to stand. So when you start getting the gripping of the toes like that, that just shows that there's incorrect biomechanical function of the lower limb, of your posterior tibialis, your extensors, all of that they're actually gripping to try and hold their position, as opposed to relaxing the toes and using your lower leg and upper leg stabilizers to have your balance. When you start going up onto points, this can be, it can and it cannot play a role. Depending again on how strong the person is. Obviously the stronger they are, and again, if we're looking at the flexibility of the ankle, which is that's where your tipping point comes from when you're on point. Again, it doesn't come from the toes. Your toes are lengthened like this, and then the flexibility comes from the ankle, whether you're going to be rolling over or not. But when you look at the point shoe, you must also remember that point shoes are made extremely different from one to the other. There are different size point shoes, different vamps, and a vamp is the front part of the shoe from the top of the, I'm actually going to show you, sorry, excuse my feet. That's easier to show. So the vamp is the top part of the metatarsals from here down to the toe. That is what we call the vamp. And then you have the width of the shoe, and then the block is the front point of the shoe. So if you've got a longer big toe, your vamp is going to probably be a longer vamp, and it's going to come down to a smaller base. Whereas if you have a wider, flatter foot, your vamp is probably going to be shorter and wider at the base. So you need to fit your point shoe accordingly to your foot if you then going to be going on to point. And that's a whole other discussion when you start working with point shoes and the type of foot and the flexibility and strength that you have through the ankle. Also the different types of brands of point shoes. So you also get the different shapes, sizes, everything, but you also get the different brands, what we call Grishkos, Evas, Capilios, all of the different types of point shoes. It's like a different type of running shoe. You've got Asics, you've got New Balance. It's same with point shoes. You've got different brands, and different brands cater for different types of feet. So a Grishko type of shoe is a very hard shoe. So you need to have a very strong foot for it. Something like an Eva is a softer shoe. So someone who is able to have more control and work through the foot, an Eva is very great. So it's not just one shoe fits all, as everyone thinks, oh, well, you've got a point shoe. A point shoe is as unique and different as a running shoe. per person.
Great. Well, thank you very much, Janine. It was a wonderful webinar. I definitely learned a lot, and I'm sure the audience did too. And once again, thank you very much for a great presentation.
Great, thanks so much. And I really appreciate the opportunity.
Thank you, Janine, so much. And Paolo for handling those questions. Lovely to have two people who are so familiar with their field interacting over this topic. And to have that sort of insight from a ballerina herself, it was something quite unique. And I think we're very privileged to have heard that, Janine. So thank you very much for that. For those who missed it or want to see it again, it'll be up on the WiSH website in the next few days. And certainly I'd like to go back and look at some of those technical issues. I certainly learned a lot, so we appreciate that. And I think when it comes to that dance interest group concept, I think it's a wonderful idea that we would try and incorporate into WiSH. So I think, as you mentioned, these issues are complex. They're orthopedic, they're medical, there's psychological aspects, there's nutritional aspects, and it fits very much into that multidisciplinary concept of interaction that we're trying to introduce at WiSH. Those little inserts you showed of those British support teams for those dancers, that's an ideal type of thing to set up, and I think it could be of huge benefit. So let's talk about that, and let's see how we can support you in that ideal that you have. I think it could be a wonderful benefit to so many dancers who wouldn't necessarily have that support. So thanks for planting that seed. We'll try and take it forward. So good evening to everybody. Thank you very much again to Sino Elita Pharmaceuticals for the sponsorship, for helping us host this evening, to Paolo for acting as the MC, and to Robin for being in the background. Thank you very much. Just a heads up that our next webinar is going to be on a Thursday, and it's in the morning, and that's because it's Heritage Day, and so you have the day off hopefully. But it's also on a Thursday morning because we have a very prominent Australian guest, that is Professor Louise Burke, the world famous sports nutritionist. So again, continuing our theme of holistic sport and exercise medicine. So it's really one not to be missed. 9 a.m. on Thursday, Heritage Day. Make sure you link in, sign up and link into that webinar. I think it's going to be a great update on sports nutrition. And we're going to be hosting that together with one of our local sports nutritionists, dietitians. And so we look forward to that. Make sure you click on the link to get your CPD points at the end of this. Thanks again for your support of WiSH and for attending this evening. We look forward to hosting you again next week. Have a good evening. Bye-bye.